question, I wanted to ask all of you guys if you guys have any family members that died of leprosy. Exactly, no one. So that's because it's extremely unlikely for people nowadays to contract the disease. So just imagine, in an 1850 old wine setting, me asking the same exact question, but the difference is everyone's hands is raised. Hi, my name is Hutchinson, and today I'm going to be talking to you about the disease I chose for my research project, leprosy. So today I'm going to be talking to you about the history, symptoms, treatment, transmission, mortality, experiment, results, social effects, prevention, and my conclusion. So history. What is leprosy? Leprosy is a chronic bacillus infectious bacterium that infects the nerves in your body, causing lack of blood flow to certain limbs. And Dr. G.A. Hansen from Norway discovered the disease that caused multiple outbreaks in places such as the Hawaiian Island chain and Europe in 1883. So some symptoms. Leprosy is extremely complicated. It has two different levels of severity, the first one being the mildest form, and is known as tuberculoid leprosy. This means that if you have contracted leprosy, you have a good T-cell immunity and results in mild symptoms, such as skin discoloration. So the second level of intensity is a moderate level, also known as lepromatous leprosy. And if you get diagnosed with the moderate level, you obviously are going to have moderate levels of symptoms, which can include skin lesions, nodules, plaques, thickened dermis, congestion, and nosebleeds. Treatment. So if you have contracted the disease, you are treated as an outpatient basis, meaning that it's not sure if you're going to get 100% cured. So there's three ways of treating the disease: sulfone therapy, chemotherapy, and Camembert oil. Sulfone therapy is basically a combination of antibiotics and chemical substances that treats multiple bacterial infections. Chemotherapy is administered orally and is a huge contribution in helping the disease to be relieved from the body. Camembert oil was more like a stigma, helping the disease get off of your body. So basically, it's an extraction from the Camembert oil seed and is used to help the skin discoloration. Due to the limited supply and the difficult distribution, it's only available in clinics. Now, the transmission. So leprosy is horizontally transmitted, meaning person-to-person contact. For example, touching, intimate contact, sharing of food and drinks with a leprosy patient. Another actually really surprising way of transmission is nasal droplets. And so what I thought was really interesting about it was that even if it is transmitted through the nose, you are clear of the disease in the nose after and during chemo. So the mortality rates. From 1964 to 1989, there are 15 million patients that were affected by the disease. And the majority of the counts done on leprosy was approximate due to the few amounts of population counts, cases that were missed, difficulty detecting the patients, and patients were concealed from authorities due to, at the time, maybe they would get arrested if suspected of having the disease. 2 to 3% of the population is affected by the disease, meaning 1 out of every 40 people will get affected. 25% of the undetected patients suffer extremely severe symptoms due to the lepromatous leprosy. So one of the cases that I found out was in the Hawaiian Island chain. It was basically a leprosy epidemic that was thought of as a curse, a result of a sinful act, and a bad omen by Christians. If you were suspected of having the disease at all, you were then arrested. Like, my great-great-grandfather was suspected of having the disease and was turned in by his own father, which was a council member of the Hawaii government. So if you're suspected, you were then sent to isolation in the island of Molokai, also known as Kalaupapa. So Father Damien was a really big factor of the process of the isolation. And he was a saint from Belgium that decided to come over knowing all the risk factors because he wanted to help all the patients. So, experiment. The objective of my experiment was to see if a multi-drug therapy would result in 2 different reactions among multibacillary patients. And the process was to find 83 multibacillary patients and 89 multibacillary patients with uniform drug and disease were diagnosed to take the drug for 3 continuous years. So the observations that they received was to see if they had different reactions to type 1 and type 2. As a result, the data actually from this experiment was not used at all, and but anyways, 31 out of the 166 patients dropped out of the experiment. 114 out of the 166 patients had a positive result. 21 out of the 114 patients had a body index of greater than 4.83 and was investigated for 42 months since treatment. 61 out of the 166 patients became BI negative. So as a result, 13 patients had type 1 reaction and 13 patients had type 2 reactions. So leprosy had a lot of social effects. So it was mostly because of Christianity, medieval, and religious reasons. Priests learned from the Old Testament book of Leviticus. They learned that if you had leprosy, it was thought of as a sin, and they then called the leprosy patients lepers, castaways, and unclean. Most of the people that found out of the patients that had leprosy treated them as if they were dying, and most of the lepers lost their property and citizenship from where they lived. So some symbols of leprosy was filth, defilement, and sin. Prevention. There was a vaccine that was started, and it was tested on armadillos, but due to the problems that arose, it was then exterminated. So one of the problems that came up was a strong correlation between protective immunity and delay-type hypersensitivity by skin testing. And another problem was it was hard to do tests due to the rareness of the disease and the long incubation time in the blood. So you never know if you get the disease until, at the most, 20 years. So in conclusion, I've informed you about the different aspects of having to do with leprosy, the cases, the developmental experiments, research done on it, attempts. Just to conclude that there's no cure for the disease. That's my citations. Thank you.
Raise your hand if you have questions.
Corey?
My question is regarding your experiment. If I were taking the multi-drug therapy and I had leprosy, would I still be contagious?
After 1 day of taking the medication, it would kill the bacteria in your body, and after about a week or so, you would no longer be contagious. Kelsey?
Is it gram-negative or gram-positive?
Actually, surprisingly, it's gram-positive. Yeah.
Is there immunity towards leprosy?
Yes. So 95% of the world's population is immune to leprosy. Maya?
Is it still possible for me to get leprosy today?
No. it is possible, but it's extremely unlikely. Other Maya?
No, I have a similar question.
Oh, okay. Taylor?
What's the first symptom that you normally develop?
It's basically skin discoloration, and it's actually, a lot of people don't notice it, but if people do, that's when you start suspecting you have it, and most likely you will. Zuri?
Is leprosy kind of related to gangrene? Because isn't it true that the limb might fall off?
Oh, yeah. So leprosy isn't like your limbs falling off. It's basically you don't have enough blood flow to the limbs,